Welcome to this video dedicated to explaining the difference between an episode of care and an encounter. We will take a closer look at what an episode of care is, a period of treatment that includes several encounters for the same health issue, and how to add an individual encounter linked to an existing episode of care. The data, patients, and doctors presented in this video are entirely fictional. They are used only to illustrate the features of HIP. Start by searching for the relevant patient. In the Medical tab, you can see that two distinct episodes of care have already been recorded. One for an ankle sprain, which has been completed, and another for lower back pain, which is still ongoing. Let's look at a concrete example. The patient comes back for a follow-up session related to her lower back pain. In this case, simply add a new encounter within the existing episode of care. You will need to select the date of the encounter and then choose the corresponding pre-encounter questionnaire. This questionnaire will then appear as ready to be completed within the related episode of care. Now, let's imagine that the patient wishes to have a lymphatic drainage session. Since this is a different type of care, a new episode of care must be created. Select the date of this session, and as this is a one-time intervention, you can set the end date to the same day. Enter all the necessary information, and once again, make sure to select the pre-encounter questionnaire associated with this session, or simply add a quick note if preferred. We can now clearly see three distinct episodes of care. If the patient returns for a second lymphatic drainage session, you can simply add it to the episode of care that has already been created. To do so, first remove the end date so that the status changes back to ongoing, and then add the new encounter. Both encounters will thus be grouped under the same episode of care. Finally, once all sessions have been completed, you can update the end date of the episode of care to reflect the actual situation. For more details, you can watch video 1, which explains how to link an encounter to an existing episode of care or create a new one directly from the agenda. We hope this video has been helpful and will make it easier for you to understand the difference between an episode of care and an encounter when managing your appointments. See you soon in our next video.